Follow the conversation. This is Afternoons on the Dove.
Good afternoon. Welcome to Afternoons on the Dove. I'm your host, Perry Atkinson, and today, well, it's a very special day. Any day that Nisha Jackson's in the house, it's special. And we have her today. She heads up Ventana Wellness, and we're going to have a special guest coming up a little bit later on. But Nisha, health is always important to all of us. Nice to have you with us.
Thank you. I love being here.
Good to see you. Before we get into your guest, we're getting this cloudy weather, and somebody called in the other day and says, really, vitamin D3 an important thing when there's no sunshine?
You know, I am amazed. I know we've talked about this before, but I am continuing to be amazed at how low people's vitamin D levels are.
Really?
And, you know, so many people that have struggled in the past with seasonal affective disorder, which is the SAD syndrome, you know, getting kind of grumpy and blue in the winter.
Yeah.
Are really pretty much treated for seasonal affective disorder as long as their vitamin D level is optimized. That's what I'm seeing. So it's one of the easiest things you can do because it's great for your energy, it's good for your mental brain function, and it's also helpful to keep you from getting the flu.
No. Well, there, better than the shot, huh?
In addition, you don't get depressed.
Yeah.
So it's really one of the easiest things that people can do, and they should do it because the unfortunate thing is that we're actually not seeing vitamin D levels coming up as much in the summertime as we have in the past. I don't know why. I'm sure it's some kind of environmental issue, but that's what we're seeing is we're just not seeing those levels coming up nicely when people used to get exposed to the sun. And I think more people are wearing sunscreen and protecting their skin, and they're just not getting that exposure.
D versus D3, what's the difference and why?
D3 is the best supplement to take because that's actually the supplement that brings up your vitamin D levels. We used to supplement, not widely, but used to supplement with D2, but it actually is D3 that you need, that all of the studies have been done on, even cancer prevention studies have been done on D3. So that's the one you want. And that's pretty much the only one that's available now in the stores.
And how much do you take?
Well, I recommend that patients take anywhere between 2,000 and 5,000 international units of vitamin D a day, sometime in the morning. They typically take it in the morning. But it really does depend on what their blood levels are. And it is important to test because, you know, some people are taking too much and some people aren't taking nearly enough. And if you're taking 1,000 international units of vitamin D a day, but your level is, say, 30 and it should be 60, you'll never get to 60 taking 1,000. You need to take more to build your levels up and then maintain it.
Does it conflict with any other vitamins like B's and C's?
Yes. If you take too much vitamin D, it actually can cause an imbalance in your vitamin A and K levels. So I usually recommend that people take a multivitamin along with a vitamin D. So, you know, just to keep those other levels up.
What about those of us who take C?
C is awesome. You know, Perry, I think about you all the time when we talk about vitamin C in the office because more and more studies continue to come out about the benefits of taking vitamin C on a daily basis. And I recommend that you take about 500 to 1,000 milligrams of vitamin C every day for protection. Good. There's just so many benefits of vitamin C, especially from an inflammation standpoint. We're starting to see more and more information coming out to show that vitamin C daily reduces inflammation, which now we're sort of connecting a lot of different diseases to inflammation. So that's important.
Let me say to our listeners and viewers, if you want to join us, you can. We can take some phone calls for a little bit. We have a guest coming up here after the break. But if you have any questions for Nisha, here's a great opportunity for you to check in. The phone number is 776-5368, and you don't have to have an appointment. She's here, 776-5368. B, I take a multi, a B, a C, and a D. Am I ODing?
No. So those are great supplements. Now, I would add fish oil. A fish oil supplement or omega-3 fatty acid because we just don't get enough omega-3 in our diet. Or make sure that you're adding enough nuts and seeds to your diet that you're getting that omega-3 fatty acid in your diet. That is so important for mood stabilization, also brain functioning, and cancer protection. There have been some nice studies to show the connection between fish oil supplementation and low levels of dementia. So I think just from a brain protection standpoint, fish oil is very important. So that's the only other one I would add at this point.
What about B for stress? Is that good?
B is excellent for stress. And you know, Perry, so many people don't realize that you need adequate levels of B12 and B6 in your system, adequate levels, in order to make all of the brain chemicals to keep you balanced and keep you from getting depressed or anxious or lacking attention and focus. So I recommend that's the first thing that even kids and adults do, is to start taking a daily B supplement, like a Mega B supplement.
All right, let's go to the phones. If you have any questions, you're welcome to join us. Nisha Jackson's in the house. She heads up Ventana Wellness. By the way, your website is?
VentanaWellness.com. It's VENTANA Wellness.com.
All right. Hi, Trish. You're on the air with Nisha. What's your question about vitamin C?
My question is, I have heard that mineral ascorbates is a true vitamin C versus ascorbic acid, which is sold out there as vitamin C.
Yes, ascorbic acid is actually okay for you to take, or ester C. You know, you have to be careful about all these, supplement companies that are advertising, because I know that you can relate to this when I say this, but when you read some of the advertisements of some of these multivitamins or different supplements, at the end of the advertisement, you're so convinced that that's the one you need to take because it's such good marketing. So I would just be careful about that. Most of the studies that have been done on vitamin C have actually been done on ester C. So I would just recommend that you take an ester C supplement.
Thank you.
All right. Have a great day.
All right, 776-5368. If you have any questions for Nisha Jackson, she's in the house here and taking your questions. And take advantage of her being here. We'll have a guest coming up a little bit. Maybe you can kind of plug who's coming our way here in a few minutes.
Yes, we have a very, very important physician joining us today. He's a urologist at Harvard. His name's Dr. Abe Morgentaler, and he's been on the show several times before. He's a specialist in the area of male hormone balance, particularly testosterone. So we're going to talk about all the negative effects of declining hormone levels. And Perry, this is so interesting to me, and I love to see this because I've always been, as you know, a proponent of optimizing hormone levels, because I really believe at some point in medicine, I hope it's sooner rather than later, that we will find out that optimizing hormone levels as people age prevents disease and illness. They actually age better and healthier. And just this last year, and I'm sure Dr. Morgentaler will talk about this, but just this last year, they showed a very strong correlation between low testosterone levels in men and metabolic syndrome. And metabolic syndrome is a syndrome, it's sort of just a catch-all title that we use in medicine, another one of those kind of catch-all syndromes. But it's a combination of high blood pressure, obesity, and high cholesterol levels, or high LDL. So it's one of those kind of going down the wrong track syndromes, leading to eventually to type 2 diabetes. So it's sort of that unhealthy state that men and women get to, but now they've tied low testosterone levels very strongly to this type 2 diabetes and metabolic syndrome. So what they're seeing is that optimizing testosterone levels for men as they age actually helps them prevent getting high blood pressure, obesity, and heart disease. Wow. So that's one of the most important things, because that's really the number one killer of men after the age of 50.
Is there another reason for low testosterone other than age?
Yes. We are seeing low testosterone in many different age groups in men today. We're even seeing 30-year-old men coming into the office with very low testosterone levels. And, maybe 10 years ago we would have said, what in the world? Why are we seeing a 30-year-old with an 80-year-old testosterone level? But the strong correlation there is that low testosterone can occur if somebody's under an extreme amount of stress. Well, who isn't under an extreme amount of stress today, right?
Right.
So, or if somebody's been involved in a motor vehicle accident, they've had a physical illness, they're dealing with some sort of emotional stress. It could be a single event, or it could be like a series of events. And what happens is that your adrenal glands, your stress glands, are really the glands that keep you alive. They keep you reacting to stress physically so that you can handle it. But when we overdo the stress part of it, what happens is that the adrenal glands, for lack of maybe more elaborate description, rob from testosterone in order to make the stress hormones to keep you alive. So what happens is that you have a decrease in DHEA levels and a decrease in testosterone in order just to handle the stress.
Wow.
So that's really one of the strongest correlations that we're seeing now with low testosterone in men is stress.
Okay. Now, normally it's going to go down with age. So do you find a balance where you're bringing it up to where it normally should be according to a man's age
group, exactly. So optimizing let's say a 50-year-old man's testosterone level we would be optimizing to that age group. It's not like we're trying to take a 50-year-old man and make them 16. That might be a little frightening, actually. That's not what we're trying to do.
How about just staying awake through dinner?
There are optimal levels as men age, so that's really what we're trying to do, is optimize them to a level that we know it helps prevent disease.
Wow. All right, so if you have any questions along this line, and our special guest will be coming up here in just a moment, we welcome you to be a part of the program, 776-5368. And again, VentanaWellness.com. Check it out, and it's a great resource for you. Her website there. All right, let's go to the phone. Hi, Mark. Go ahead. What's on your mind today?
Yeah, I got a question on, I was diagnosed with being bipolar a while back, and just now overhearing Nisha Jackson saying that vitamin B is good for the chemical imbalance in the brain.
That's right.
Right now I'm currently taking medication, prescription medications, which is Abilify and Zyprexa.
Yes.
Now, would I be able to take or try taking vitamin B over that, over the prescription?
Absolutely, because the interesting thing that we're seeing now with certain medications, and the medications that you are on are actually fit this category, is we're seeing that certain medications actually lower the body's levels of B vitamins. But it takes B vitamins in order to give you a better brain chemistry balance. So it's sort of a bad little trick maybe that medication plays on us, but I would say absolutely you should be on a super B complex in order to enhance your own body's levels of B vitamins in order to actually help you cope better from an emotional and mental standpoint.
Okay. Do you think I can maybe get your phone number for my mom to maybe talk to you about it?
Sure, absolutely. You can call the office at 773-9772.
773-9772.
Correct.
You got it.
Have a great day. Thanks for calling in.
Well, thanks, Mark. Okay, let's see if we can squeeze in Vicki before the break. Hi, Vicki. What's your question for Nisha today?
Well, it kind of ties in with the question before. I have been on medication for depression for probably 15 years now.
Yes.
And just recently actually had to add an antidepressant to my other antidepressant. And I am just really concerned about the long-term effects.
Yes.
And I was wondering what your success is in finding combinations of supplements to get people off of those medications.
This is a touchy subject, and I'm sorry that you're having to go through this, because I know it's frustrating, and you probably have a lot of questions that maybe aren't being answered. But I would say two things that are very important for you. One is to get your hormones balanced. Mm-hmm. We know that hormones are very important in the area of mood balance. And I also think that it might be helpful to actually look at some of the brain chemistry balance. You can actually have some of the brain chemicals tested via the blood, or even just doing subjective tests in the office. That might be helpful to know what supplements could be used with your current medication in order to provide a better benefit for you from an emotional standpoint. The other thing that I think is important is to try to get to a place where you feel really good and then address possibly coming off the medication. I personally have...
That's the hard thing.
Yes. But that happens through diet, it happens through lifestyle changes, and it happens through balancing your hormones that support your mood. Mm-hmm. So I would really encourage you to get that testing done. We do it in our office, and it's very helpful. You get a person to a place where they're more emotionally balanced and hormonally balanced, and then they can come off the antidepressants very slowly with the right supplements to balance the brain chemicals. So that's how I handle it in the office, mm-hmm. and I have great luck with it. So,
do you find that this is kind of off subject, but is it covered by insurance, that type of?
Absolutely.
Okay, great.
Yes, absolutely.
Right. Thanks, Vicki.
Have a great day, Vicki. Thanks for calling.
We're going to take a quick break. We'll be right back. Nisha Jackson's in the house. We'll have a special guest. We're going to Skype in here as well. If you got any questions or comments, you're welcome to join us, and go to her website, VentanaWellness.com. We'll be right back.
Follow the conversation. This is Afternoon on the Dove. Follow the conversation. This is Afternoon on the Dove.
Okay, we're back. Nisha Jackson's in the house. She heads up Ventana Wellness, and we got a special guest that we're Skyping in. And I just want to say, all right, fellas, listen up. And if you want to call in and use somebody else's name, go right ahead. And this is going to be an interesting topic, to say the least. So introduce our guest today.
All right. We have Dr. Abe Morgentaler. He is in the show. He's actually, I get to see him today. I usually don't get to see him. This is maybe the third or fourth time he's been with me on a show talking about the importance of male hormones, especially testosterone in men. And he is the Associate Clinical Professor of Urology at Harvard Medical School, and he's also the founder of Men's Health Boston, which is a center focusing on sexual and reproductive health for men. He's written several books, and the one that I love that I have in every exam room in my office is called Testosterone for Life. Recharge your vitality, sex drive, muscle mass, and overall health. Welcome to the show, Dr. Morgentaler.
Thanks. Great to be with you.
I am so excited to actually be seeing you. You're so handsome.
Oh, you're very kind. Thanks so much.
So how have things changed in the area of testosterone for men since I talked to you last? I know it's gaining more and more momentum as new studies come out showing the benefits of optimizing testosterone for men as they age. Have things started to change a little bit in the testosterone world for men?
Oh, my goodness. You know, it's really remarkable. We just had our national meeting of, if you'll believe it, what's called the Sexual Medicine Society of North America. Sounds like a good time, right?
Wow.
Of all places, Las Vegas. And but there's so much testosterone work going on now. I think that throughout the country, I think that there are now quite a number of clinicians, especially compared to even 5 years ago, who are now savvy about the idea that so many men may have low levels, that treatment may help them both sexually, and then I think the hot new thing is that it helps them with general health too, in ways not just about sex or sex drive. And I think that's really a key thing now. And so men are trying to figure this out. The women who love them sort of often recognize that the guys aren't, themselves. And I think people are now getting care, which is great.
You know, when I first started looking at men's hormones, because I've been working with women and their hormones for 20 years, but when we really started looking at men and their hormones, men would often be drug in by the ear by their wife or their significant other. But now I'm actually seeing the men coming in on their own. So definitely there's more information out there about men and hormones and some of the health benefits of optimizing those testosterone levels.
You know what I think is important is that, if men don't like going to the doctor in general, but part of the reason they don't like it is they may not feel like there's anything that's going to make them feel better. It's like sometimes they don't want to hear any bad information or get tested or invaded in some terrible way.
Right.
But once guys get the sense that there's a treatment for them that may make them feel better, be more sexual, be more active, less tired, more like they used to be, then I think that they are engaged and they will come in and be looking and asking for help.
So tell me what your thoughts are, because, you see men as they age and they often are gaining too much fat around the middle part of their body. They're losing their head hair. Maybe they're not as sharp mentally as they used to be. They're getting a little grumpy. Maybe they're going towards the area of high blood pressure, high cholesterol, that whole metabolic syndrome issue. Is that something that you feel that if we can catch men early enough that maybe we can keep them from going down that path?
Well, here's what's really interesting about all this. I mean, the short answer is yes. Testosterone, having normal levels of testosterone is not a cure for everything. Not everything is testosterone related. But on the flip side, it's really common for guys in their usually beginning in their 40s, but it can happen earlier. Guys in their 40s, certainly in their 50s and beyond, have lower levels of testosterone, and it can cause symptoms and it can cause worse health. The symptoms tend to be less sex drive, erection's not as good. The non-sexual symptoms usually relates to lack of energy, lack of pep, a sense of the vitality is gone. Mood can be kind of depressed, or how I ask the guys, do you feel blah? You sort of feel grayed out. And stamina, workouts at the gym, all that stuff is related. And when we find it, if the testosterone is really low. It's easy to treat it. And not everybody responds, but I'd say somewhere around 3/4 of men with low testosterone who get treated properly end up feeling improved, and their health is improved too.
Now, I want to spend just a couple minutes about talking about the treatment, because the treatment plan can be pretty dynamic depending on what situation in health a man is in when he comes into the office. Because, we like to address the diet, the sleep patterns, the stress, the liver function, how healthy is their liver, all of those things when they come into the office, which I feel very strongly correlate to their outcome as far as how well they do using the testosterone. How important do you think that those other factors are in somebody recovering from low testosterone symptoms?
Well, I think they're important, but the question is, how much of an impact can we have? So there are things that go in both directions, So, for example, men who are obese or overweight often have lower testosterone. If they lose weight, can their testosterone rise? The answer is yes. But a guy who has low testosterone who just decides to lose weight if he's got symptoms of low testosterone, there's no hard data on this, but the likelihood that he's going to get back amazing testosterone levels is a little bit unlikely. So, but it's clearly important as part of the whole picture. So, I agree with you 100%. All those things are important to be paying attention to. But once a guy really has low testosterone and the symptoms of it, as much as I'd love to just say diet, exercise, do all the right things, and you'll be okay, a lot of those guys actually need to be treated. That's where they're really going to get the oomph.
Yes, I totally agree. Dr. Morgentaler, are you seeing younger men coming in, being tested, and seeing lower levels than maybe we have in the past? Or is it just that we're testing more people? Because I know we're seeing younger men in our office that are really complaining of a lot of low testosterone symptoms. And then when we look at their free testosterone level, it's alarmingly low. Is that something that you're seeing in your practice too?
We see a shocking number of young men with low testosterone. It doesn't, we never used to look. I mean, we thought that low testosterone was a problem of men in their 70s and their 80s, but it's not true. So I've seen men, frankly, who are teenagers. They've gone through puberty, but their levels still aren't right. And certainly we see some men in their 20s and quite a few men in their 30s. And it's hard to know exactly what's going on with that. Part of it is that also if men have certain problems, we mentioned obesity already. Obesity drops your testosterone. Men who are on painkillers can have incredibly low testosterone levels. And there's a lot of painkillers being given out there these days for good reasons or maybe not so good reasons. Those are some of the lowest testosterone levels we see. But here's the most important thing for the folks who are watching your program is that if there's a guy out there who feels like, you know what, I'm like doing all the things I think I'm supposed to be doing, but I don't feel right. I'm tired. I have no pep. My mood is blah. I'm not chasing my wife or my girlfriend around anymore. That guy should be tested for low testosterone, because if it's low, there's a great chance he can feel himself again with treatment.
So let's talk about the testing, because I totally agree with what you're saying. And I don't think any man that's having symptoms should not come in. I think that there could be other things going on also. So getting tested is important besides just the testosterone level. Having a good evaluation is important. So as far as the testing goes, would you recommend that a full panel is done, that you look at other things besides testosterone levels? And also the difference, maybe we should address the difference between total testosterone and free testosterone, which just that subject alone seems to be confusing in the medical community.
Well, I get, when guys come to see me, we're often kind of like the place of last resort. We see a lot of guys who have already been evaluated by their primary care doctors and have either gotten mixed messages or been told that they don't really have the problem. So we get a fairly a moderately extensive set of tests. But I think that the key, if somebody really wants to be screened for this, is the total and the free testosterone. The total is what most doctors trained on, and most of the written work about testosterone is based on it. But there are a lot of men who have normal appearing total testosterones, and their free testosterone is the clue. The free corresponds more to what's biologically active or bioavailable. So we have a lot of patients who see their doctors. Doctor says, well, I thought, he's looking at his report. He said, I thought you had low testosterone, but your level here looks normal. You don't have it, and I'm not going to treat you. Well, a lot of those men, we see them as second or third opinions. They have low levels of free testosterone. They have classic symptoms, and those men respond to treatment just as the guys with classically low total testosterone. So important to get both a total and a free if a guy's going to get screened.
Okay, I want to come back and ask one more question about that, but we're going to take a caller first. David, you're with us in the show today. What's your question?
My question is, my problem is I don't produce testosterone at all, and I was on testosterone replacement therapy for 30 years, and somebody accidentally overdosed me. I was at 1,300 free testosterone, and I was so disgusted with what it did to me, I quit altogether, and now the last test I had, I was 36.
Wow, that's quite a change. Dr. Morgentaler, would you like to address that question or comment?
Well, I'd be curious what the problem was that our caller had when the level was too high. Sometimes with some of the treatments like injections, the levels can go above the normal range for a few days, and then they drop back down into the normal range. But, one has to, it's like anything. We need the right amount. We don't want too much like the bodybuilders and the guys who are taking, anabolic steroids for performance enhancement. And we don't want too little. We want the right amount. That's why testosterone needs to be administered by, clinicians who are going to do it right and monitor the guys. That's what's important.
I was monitored. I've been on 33 years. I was on HRT. My body, I have hypogonadism.
Yeah.
So I never, ever did produce testosterone. And now my emotions are out of control. I'm irritable. I'm angry. I'm having hot flashes. I'm basically going through what women go through with menopause.
Well, David, maybe it would be a good idea for you to try to find a happy medium and be followed very closely, because I think that there's the thing that you might want to take into consideration now is there's some health complications of not having enough testosterone at all. So I would say that maybe looking for somewhat of a happy medium there with your testosterone level might be good.
Okay, I actually came into your office last week, but...
Good. All right. Well, maybe we can get you going down the right path.
All right.
Thanks, David. Have a great day, and thank you for calling in. We're going to take a quick break.
Yep, we are, and we'll be right back. If you want to join us, the phone number is 776-5368. We'll be right back with Nisha Jackson right after this.
Follow the conversation. This is Afternoon on the Dove. Follow the conversation. This is Afternoon on the Dove.
Okay, we're back. Nisha Jackson's in the house, heads up Ventana Wellness, and that's ventanawellness.com. If you want to check it out on the website, if you want to call us, you're welcome to do that. The phone number is 776-5368. And I'll let you get back to your special guest. What an informative program.
Yes, we have with us today Dr. Abraham Morgentaler, and he is with us. He's been with the show several times before, and he's a specialist in men's health. He's a urologist at Harvard, and he's written several books. The book that I love and keep in all of my exam rooms is called Testosterone for Life. Thank you for taking the time out of your busy schedule. I know you're very, very busy to meet with us again today, Dr. Morgentaler. I also want to announce to our listening audience and the people watching us what your website address is.
Great. It's www.menshealthboston.com. Menshealthboston.com.
And people can pick up this book at any bookstore, is that right?
Yep, or you can order it through Amazon or any other place. Yep.
All right. And can they get this book on your website?
They can. They can get right there. Click and you'll get it.
All right. I have to say, I'm just so happy that I can see your face today. You know, the bad thing about radio, and that's what what you've been interviewed on in the past with me, is that I can never see somebody's face. So it's so great to see your face today.
Thank you, Nisha. You're very kind. Can I tell you what I'm excited about today?
Please.
So one of the coolest things about testosterone, you and I have talked over the last few minutes about, how the guys have symptoms and how treatment can make them feel better and more sexual, and it's good for your general health. But the big fear over the past 70 years has been that higher testosterone would lead to more prostate cancer.
Yes, we were just talking about that at the break, so I'm thrilled that you're bringing this up.
So this is what I kind of cut my teeth on, if you will, is really, because that was the biggest hurdle with testosterone. Everybody was worried, doctor, if I take this, might I get prostate cancer that's new? If I have a hidden prostate cancer, will it grow? Listen to what we've just done this year, what we published in the Journal of Urology, is we took 13 men who had prostate cancer. Now, you're not supposed to give them testosterone because they'll, in theory, for years we believed it was going to make it grow like crazy. 13 men with prostate cancer who chose to not have their cancer treated. That's something we do more and more of these days. If it doesn't look too aggressive, we just watch it. We call it surveillance. Those men had low testosterone. We treated them together with my colleagues down at Baylor. And they all get follow-up biopsies at a year, 2 years, and usually a year or two after that. After what we published was in these 13 guys with untreated prostate cancer, just sitting there where we raised their testosterone, is that none of the men had an increase in PSA, none of the cancers progressed, none of the prostates got bigger, and in fact, over half of the follow-up biopsies, we couldn't even find cancer at all.
Wow.
That's the first time since this idea came out that testosterone was bad for the prostate, the first time in 70 years that anyone has bothered to actually look at the prostate itself and what happens if we raise testosterone.
That brings up an important question, and that is, how many physicians are still out there saying, it just might cause a problem with, enlargement of the prostate or cancer of the prostate. And so then men really aren't getting access to testosterone. I mean, I know that that's still prevalent even in this area, but are you still seeing that with urologists today despite studies like this?
Absolutely. It still goes on everywhere, but it's starting to change a little bit. So we now see one of the things that I see most commonly, the reason why people will go to the trouble of flying to Boston to see me now is because there are more and more men who have been diagnosed with prostate cancer. And a lot of them are pretty young, and they've got symptoms of low testosterone, they have low levels, and it still is hard to get doctors to treat them. Understandably, it's controversial, but that's what we do now. So I'm not saying that nobody's cancer is ever going to get worse, because some people do that whether they're on testosterone or not. But we now provide testosterone to a lot of men who have been diagnosed with prostate cancer before. And so far, knock on wood, those guys are doing quite well. We have somewhere around 200 to 300 of those men without any significant problems.
Well, if half of the subjects at the final biopsy had no signs of cancer, I would say that's a pretty decent outcome of that study.
Absolutely. We were thrilled. We didn't know what to do. I'll tell you how we got started doing that, because that was kind of a nutty thing to begin doing. I had this 84-year-old man come to see me, totally sharp, a lawyer, beautiful head of white hair. And he had some sexual problems. He had low libido. He couldn't have an orgasm. I hope we can say that on the show. And he had low testosterone. He also had a high PSA, about 8, which is really quite high.
Right.
And I said to him, you know what, I don't do a lot of biopsies in men in their 80s, but your PSA is pretty high. Maybe we should find out if you have cancer. He says, I'd like to know. So we did the biopsy. He had cancer on both sides of his prostate, which isn't always so great. That means there's a fair amount of it. And we talked, and it wasn't too aggressive. He said, I don't want to be treated for it. I said, great, I think that's reasonable. We'll just watch you. And then I'm ready to leave the room. He says, but doctor, what about that testosterone? I want to try it. And I had never treated anybody like him. And after a long conversation, he says, doctor, I'm 84 years old. What have I got to lose? So, we wrote a long informed consent in the chart. And we followed him for a few years. And his PSA started at 8, it went down to 7, it went down to 6, it went down into the 5s, and after 2 years, it stabilized at 6. That man is now 89 years old. He's still in my practice. He still is fine. He's still on testosterone, and prostate cancer has never really been an issue for him.
That is phenomenal. Wow. Before we end the show, Dr. Abe, I want to make sure that we talk to you about the types of treatment that might be available, because there's so many different options, and not every man really can use the injections or wants to use the injections. What are some of the options that men might have for testosterone replacement therapy?
Well, there are several new products that are out there. There are a few different kinds of gels. They're like creams that guys rub into their skin once a day, but you really have to do it every day. Injection's been around for about 50 years. That's not a bad way to do it, but it's a shot that either the guy does himself once a week, or he comes into the office and gets it every 2 weeks, sometimes 3. One of the things we like that's relatively new is the pellets. We place these little pellets under the skin in the buttock region, numb it up, takes 5-10 minutes, and then those last for about 3 to 4 months. So that's very convenient for the guys, and we've had an excellent experience with that as well.
Oh, that's such a great option. I know that's a good option for women, too. I want to remind everybody that's watching and listening today that the website for Dr. Abe is menshealthboston.com. If you want to get more information on this subject of optimizing testosterone levels as men age, you can go to that website, menshealthboston.com. And Dr. Morgentaler's information is on that website if you want to get some more information. What about just some final comments maybe that you have, Dr. Abe, that you want to make sure you get out to the public? Because I think this is a great show to be able to do that on.
Thank you, Nisha. Listen, here's what I think is important. This is a really common problem, like remarkably common. And it's underdiagnosed and it's undertreated. Here's what we know: if you don't treat your low testosterone, not only will you have symptoms usually, like low sex drive, fatigue, lack of energy, and some degree of sort of depression or depressed mood, but men with low testosterone compared to normal men have double the risk of developing diabetes over 7 to 11 years, double the risk of developing metabolic syndrome, which is a indicator of cardiovascular disease, triple the risk of getting osteoporosis and fractures. And there now are 4 studies that have shown that men with low testosterone actually die sooner than men with the same degree of medical issues who have higher testosterone levels. More and more, what it's looking like is that a normal level of testosterone is actually important for our general health and also how we feel.
So tell me how those statistics are amazing. I mean, they really are. How are you getting this information out there? I know that you're working really hard. I see your name in different journals and articles that I read. So I know you're really doing a great job getting that information out there. But what is your plan, do you think, within this, even the society that you're involved with, to get more information out to medical providers that can start testing more men?
Well, I think my first plan is to talk to you more often on this show, Nisha.
I'd like that. That's a very good idea.
Listen, the education needs to be out there. One of the things that's interesting is that how much this has been driven actually by the public. Most physicians in medical school didn't learn about this idea, and I didn't, that men who are otherwise normal and generally healthy could go through normal puberty, could have a normal early adulthood, and then somewhere in their 30s, 40s, 50s, or beyond, drop testosterone to a point where it really affects their lives and their health. That hasn't been taught in medical school. It's a relatively new concept. And so there still are a lot of docs who aren't savvy about that. And, you know, there's a lot of resistance about hormones in general. And I think there are all sorts of reasons about it. Hormones for men, hormones for women. People worry about cancer, heart disease. Maybe it isn't nature's way. Maybe it's not God's will. And you know what I think? I think that aging is really lousy. I think aging is associated with, you know, bad eyes, bad hearing, bad teeth, bad joints, bad blood vessels, and cancer. Those are all normal, if you will, natural consequences of aging. Well, we treat all of those because so we can live better and live more healthily. Well, the same is true with testosterone. We lose it as we get older, and in some men it becomes a problem, and I don't see any problem with treating it.
Well, and I think as men live longer, you know, and not only living longer than they have, you know, in the past, they want to live healthy. They want to have a nice amount of energy. They want to have good vitality. They want to feel well. And they don't want to be plagued with some of the diseases of age that are age associated, which now I think are really hormone decline associated. So I think that that's one of the things that's so important too, is really getting men to a point where they can understand, here are my symptoms, here are the tests that can be done, and finding somebody that can do that for them.
I couldn't agree more. You know what's interesting is the difference between making it through your day and making it through your day well is really, I don't know, I'm a number kind of guy. I think it's about 5%. You only need a little extra to feel really good about what happened. And a lot of guys they've been knocked down a notch. Now, testosterone isn't going to make everybody feel better. A lot of people who are watching your show, they may not feel perfect, and it may not be testosterone. But you know what? For men where the testosterone level is low, treatment for some of those guys makes all the difference in the world.
I totally agree. We definitely see that in our practice. Thank you so much, Dr. Abe, for taking the time to be with me today. I appreciate your information. I appreciate all of the information you're getting out into the community and across the nation. Again, if you are out there listening to this or watching this show and you have low energy, your mood's not as good as it should be, maybe you're getting a little bit more grouchy, you've lost a lot of your pep and zest for life, maybe getting too fat around the middle part of your body, low libido. These are all signs, could be signs of low testosterone. And Dr. Morgentaler and I both encourage you to get tested and seek good treatment for optimizing those levels. Have a great day, Dr. Morgentaler. I really appreciate you being here.
Thanks, Nisha. Great to be with you.
All right.
you. And again, don't forget, you can check out Nisha at her website, VentanaWellness.com, and the book. Maybe we can get up on the screen real quick. There it is, one more time. Testosterone for Life. There it is. Check that out as well at Barnes & Noble, Amazon.com. Thanks, Nisha. See you next time.
All right.
See
Have
ya.
a great
Bye-bye.
week.
You too.